modalities. So under E-Stim, you're going to have, first of all, you pull up your Chattanooga screen and you can see right here all the different types of electrotherapy that are offered from Chattanooga. Interferential at the top, medium frequency, that would be pre-mod is a medium frequency, Russian stim. So after a while, you kind of look at all this and it either makes sense or doesn't make sense. So let me try to differentiate everything out into different categories. So under E-Stim, what I'm going to do is split it into an E-chemical and an E-kinetic. And I'm going to put E-chemical here because it's really not a very big category. The one that we've already learned has been low volt galvanic. And galvanic always means that there's going to be an acid base. When you're looking at low volt galvanic, the other names it could be is DC, or it could be called a smooth wave galvanic. And the reason is because the waveform looks like this, where it's all above the x-axis, and in this case this is a positive treatment, and if it were down here, it would be a negative treatment. And as you can see right here on the Chattanooga, you're going to push the DC button. Now, when you're trying to differentiate in your E-chemical treatments, which is going to do what? You know, is it going to be is it going to be good for chronic, or is it going to be good for acute? Here's what we're going to do. If it's up here in the positive zone, you're going to remember it as how you want to graduate school. It's AAA+. It's going to be the anode is going to put out the acid for treating acute, and that's going to be the positive pole. Versus if we're going to look down here into the negative, then it's the rest of what we haven't named already. So it's going to be the cathode is going to be putting out a base, and that's for treating chronic, and that's a negative. When you want to soften tissue, you're going to choose which? The base or the anode? Well, think about it. When you have an acute injury, you want to figure out, do I want to soften tissue or harden tissue? You want to soften tissue when you have a chronic problem. So the way I remember this is, what does the acid do to the tissue? Well, the acid does what ice would do to the tissue. For example, if you have acid, and that we know that's for acute, it must harden the tissue. And of course, if you're looking at the cathode, it's a base, it's treating chronic stuff, just like taking a nice hot tub, a hot bath, putting on a hot pack, using some of the diathermies in order to soften the tissue. The cathode, the base, is going to put out an effect that's going to soften the tissue. Okay? Now, that's all E-Chem. So now I'm going to go into the E-Stim, and I left a little bit more room on this board for it because that's pretty much it for what we're going to need to do in our classes. For this section here, under E-Stim, we're going to do the E-kinetic. And what does that mean? There's a movement. And we've learned 3 different modalities, and each modality has a little bit of a different feature to it. So the first one I'm going to put right here next to the LVG because it's called LVF. And what that means is that the LVG has a converter in it, and it's switched over to LVF. So now it's going to be it's going to be an action potential. So you want to see an action potential over and over, just like that. The next thing, I'll do a better one. So it's a positive, negative, and you got an action potential happening. When you have switched to something like this, it's crossed over the x-axis and gone from positive, negative side of the x-axis, you are no longer going to have a possibility of accumulation of an ion. So here we had accumulation of acid, here we would have had an accumulation of base. When you're doing the low volt faradic, you're actually going to cause a contraction because it's going to affect the motor nerve. The second one that we have learned in class is going to be the HVG. Now this one's interesting because it's got the G as in galvanic, but they found because the HVG comes out as a double peak, that it does not cause a galvanic reaction or ion collection. So what you can see is with this double peak, there's actually a pretty cool little phenomenon called the microsecond interval space. It's the amount of time, microsecond interval space, it's the amount of time that goes between two peaks. And what we found is if you have a peak that's very close together, and I'll use this string right here, if the peaks are close together, you can see how deep it can affect the tissue. And this is not exactly the true physics, but it's a great way to memorize it. Close together peaks is going to feel like a deeper penetration or deeper contraction. So if you're using a more superficial muscle, or when you're starting your motor nerve stim, you want to start with a very wide MIS, meaning that it's a long distance of time between the two peaks. So a wide MIS is how we're going to start. And then after the person's intensity level has been set, then we'll bring it down so it's comfortable. And it goes to a comfortable tolerance, and then we can narrow, and get deeper into whatever tissues we want to work with, unless we want to work superficially. So our goal is deep, then we're going to need to hopefully narrow that MIS. So this little part right here, I'm going to label it, it's called the MIS, and that's the microsecond interval space. So it is a time thing. The third E-kinetic, and hopefully this camera can see this, is going to come over here, and this is going to be the medium frequencies. Under medium frequency, there's going to be 5 subcategories. The first category I'm going to put right here, and it's just going to be a bipolar setup, and it's going to we're going to use things called a beat frequency. This one here is going to be a quadpolar, and again a beat frequency. There's going to be some other things like something called BUMF, which stands for unmodulated medium frequency, and that's going to be for pain. And the other one for pain was, yes, it's going to be the subthreshold, and that one's going to be where you don't get a real contraction, you just get a sensation of the contraction. It's a subthreshold setting, and it's 90 to 100 cycles per second, and that's also for pain. The last one that we're not going to talk about right now, because it needs a special setup, is Russian stim, or the COTS protocol. And the reason why I want to save this till later or to a different discussion is I want to focus on these ones for right now. This one you have to put a pad on the nerve root and a pad on the muscle belly. And this is that one that you do at 50 hertz in order to cause a contraction. It was used in the Olympics a long time ago by a Russian doctor, Dr. Kotz. And this one will have a carrier frequency of 2500 hertz. So carrier frequency for the bump was going to be 4,000 to 5,000 hertz. Those are called carrier frequencies. Now, I'm not going to talk more about those medium frequency things because I want to focus in on right here, the part that seems to confuse people. Which modality should I use? Should I use a high volt? Should I use interferential? Should I use pre-mod? This particular machine does not offer a low volt faradic. So I have in my PT lab all of these different machines, old machines, new machines, and I have to figure out which machine I'm going to use. So in this case, I'm going to figure out which one of these 3 to use. Now, what I've noticed as a patient, and a lot of my students have said, and patients, is that the low volt faradic is the least comfortable. The high volt galvanic is a really good contraction. It's slightly more comfortable than the low volt faradic. And then the medium frequency seems to have the most amicable, enjoyable, if you will, type of contraction. It matches the body's receptivity better. So when you're under these 3 things, you're always going to have 4 different frequency setting categories. So here's how I'm going to have you guys memorize this. When you're doing of the 4 frequencies, these are the 4 names. SICF, if you want to remember some funny little way to say it. It's going to be static, and this is going to be a 1 to 10 cycles per second. And this one's going to be, so the way I look at this is give it a name, give it a frequency, or hertz, or cycles per second, or pulses per second, then give it an action, and look at what physiologic effect you have. Okay? Now, the question is, what does the static do at 1 cycle per second? That's kind of like doing this. Doesn't that look a lot like doing myofascial adhesion trigger point work? So in that case, I'm going to say that this is going to be a vigorous contraction, but it's not to the point of tetany, which means the contraction goes into moving the muscle. So it's a vigorous contraction. It looks like a shimmer in the muscles, or if you do it slowly, you can actually get a kind of a beat, and you can count the number of cycles per second. And this is for breaking up myofascial adhesions. The next thing is going to be the intermittent. An intermittent setting is going to be something we're going to use at 12 to 20 cycle per second. And this one's known for doing pumping effect to get rid of edema. So this is the one that we can use in a subacute phase to help pump out the edema. Static is going to be used, of course, in a chronic phase because myofascial adhesions tend to be something that's been around there for a while. They're adhesions. The next one is going to be contractive, and when you do a contractive tetany or a contractive motor nerve stim setting, you're going to be doing it within the range of 40 to 70 cycles per second. A lot of people will go up here and just use it at 50 hertz because it goes with the Russian stim concept. And what it does is it contracts the muscle. And when are you going to do this? You know, to decrease atrophy, to re-educate muscle, and various other things. Just basically get the muscles back into their strength and to their coordination. On this one, you have to have a surge or a cycle time, which means when you're going to contract, you want to lift up that weight and do it for maybe 10 seconds or 5 seconds. So let's say you do it for 10 seconds. You better give enough of a relaxation so that the muscle can recover and not prevent and not actually have DOMS. So you're preventing DOMS or delayed onset muscle soreness. So when you have the contraction, you do it for 10 seconds, you're going to have 50 seconds off. So that's a 10 to 50 or a 1 to 5 ratio. 1 on, 5 off. 1 on, 5 off. Just like when you're working out in the gym, you'll do your legs and then you do your arms, because by the time you come back to your legs, you've had your break. And I'm not sure you can actually see the bottom part of this and the way the camera angle is there. So I'm going to write the last one. The fatiguing tetany is going to be set to an 80 to 120 cycles per second. And this one's going to be to fatigue muscle spasms. This is probably the most common one the chiropractor will use. He will have a muscle that's going into a bit of a reactive muscle splinting or spasming. It's not actually causing a movement of the body. It's more like a solid contraction. Hypertonicity is what we call it often. And it's reaction to the pain that's happening from the joint capsule tear, or from an adjacent muscle having a spasm or a Charlie horse or a cramp or a tear, an injury. So when I'm looking at using this modality, one of these motor nerve stim modalities for my patients, I'm going to, let's say it's a low back spasm, I'm going to put the pads on the low back where I want to surround the area or be on the area, and I'm usually going to use a fatiguing tetany. With this one, you need to have it on for at least a 5 to 1 ratio. Now, most new machines don't offer the old 5 to 1 ratios. Some of the old ones still do, so you can use that. But often you'll have to go to a 5 to 5 ratio. So it means 5 seconds on, 5 seconds off. Or you could go to a 10 second on, 10 second off ratio. The new Chattanoogas and the generation before that, a lot of the new motor nerve stim out there, they offer a 10 to 10 or a 5 to 5 ratio. And that's seconds in terms of on and then off. So with the fatiguing tetany, that'll be the most common one that you're going to use in the chiropractic office. I'd say the second most common is going to be static, for using it for myofascial adhesions. The third most common, I would say, is going to be working with people with subacute injuries, and just a little bit of stimulation there helps pump out some of the edema that's going on in there. And then the contractive you may use if you're helping people regain strength after having been immobilized due to casting or due to injury, due to muscle splinting and unable to move, bed rest, that kind of thing. There, of course, are contraindications to all of this. That's not part of this lecture. This is just to show you the different frequencies and the 3 different ways that we can do these frequencies. The last thing I want to talk about is pad placement. Now, with pads, you have to make sure that you have used the correct pads and the correct size. So up here I've done just a real quick overview of the pad placement. But basically, what you want to do, like in this case here, we have 2 leads, and this particular set of leads right here is channel number 2. This particular set of leads is channel number 1. This would be an example of doing two bipolar setups with a medium frequency. So here's the scoop. When you have a medium frequency, you're going to use either two pads off of one channel, or you're going to have two channels, and you can either set them up so they're two bipolars, or you can do something called interferential. Back to the next screen where it shows the interferential option. Interferential means to interfere. So you put channel number 1 and channel number 2. This is the concept that these two will crisscross and cause an area to be treated rather than only under the pads. If you use interferential, you're going to need to set something called a vector. And a vector makes the patient feel like this, like the stimulus is going all over the place. But really, it's not at all moving the pads. What it is it's going to cause channel number 1 to go from a certain set intensity, you'll set it in the beginning, and then dip down to either 0 or maybe 60%, and then the other channel is going to do the same thing. So here's how I describe it to my students, and you guys have seen me say this. It's going to be channel number 1, channel number 2. Let's say we set the entire intensity for the interferential to 10, and what we're going to do, it's going to be 10 milliamps. And so here they are, and the person says, yeah, that's enough. And now what you do is you hit the vectoring, and let's say we hit a 40% vectoring on like Chattanooga. What that means is it'll go from 10 down to 6 and back to 10 and back down to 6 and back to 10, back and forth and back and forth. That's what's happening on channel 1. So now the person can't tell you where the pain is. They're like, well, I'm, or the stimulus. They used to feel like under one pad and under another pad, but now it's going back and forth. This channel, on the other hand, is going at a different rate. So this is pumping back and forth in terms of intensity at one rate, and this one over here is in terms of intensity at another rate. Now, words that you can't get confused are super important to understand. Intensity is like the loudness, the volume. The intensity is the amplitude. So sometimes you'll see the words amplitude modulation. That means vectoring. Sometimes you'll see the word scan. That generally means vectoring if it's changing the amperes or the intensity. So when I talk to my students, it's like punching me hard or soft. It's not punching me faster or slower. That's all amplitude. Okay, so when you're doing faster and slower, then you're talking about the 4 frequencies, like the static, intermittent, contractive, and fatiguing. When you're looking at the frequency, it can be cycles per second, hertz, or pulses per second, and it's how fast you're hitting me. I don't change the intensity. It's not heavier. It's not heavier. It's going to be actually slower and faster. So fast, slow. But I'm not going heavier. You will see a lot of options on these machines where they're going to give you a chance to sweep through the frequency or to stay at a continuous frequency. Continuous frequency means you set it at 100 cycles per second. That's what the person's going to get the entire treatment. If you don't want them to get used to it or accommodate, you can set it so that the frequency will change within the range for that modality setting. So for fatiguing, 80 to 120. And the patient will feel it going faster and slower and faster and slower, and it's like hearing a drip outside from the drains. And you can't, if it's going at the same rate, you get used to it. But if it's variable, you can't get used to it. So this is called the sweep phenomenon for frequency. So you sweep fast or sweep slow, and that's going to prevent accommodation or getting used to the sensation, the speed of the frequency. The last thing to talk about, what size pad do you use? So back to that previous slide. You got little pads. This pad here, if it's square or circular, is called a 2-inch sized pad. Although it is like a 2x4, it's not actually a full 2 inches, like 1 inch and 3/4. So this is considered a 2x2, or a total amount of 4 inches, because 2x2, it's going to be 2 times 2 is 4. This is a bigger one. This is going to be a 3, so this is a 3x3 or a 9. When you're doing anything electrochemical, you need to have a small pad called active and a large pad that's 4 times the size at least, so it's greater than that, called dispersive. This is so that you put the active pad on the injured area, my elbow, my lateral epicondylitis, and the dispersive pad somewhere big where it doesn't tickle, low back, thigh, bellies don't work, and it's an acute elbow problem, so we'll use the anode. So we'll set the DC setting to the positive, and we'll put it on the little pad on that area. And when you're using Chattanooga or any of these machines, you have to figure out which is the active lead. So the new Chattanooga that I've been showing here, the red on channel 1 is your active lead. So you put that right here. Then you put a big pad on the back. And that will make the back not get very much base, because if acid's going here, base is going there. And you don't want the base to accumulate in a place that doesn't need treatment. If you use HVG or low vol faradic, you're going to need to choose pads that work. Sometimes people will take 2 pads and put them on one muscle, and they'll cause a contraction. Sometimes you want to only treat a muscle, like this levator scap, and you don't want to treat anything else. So in the case of 2 pads on one muscle, you can just put 2 equal sized pads on one muscle. However, if you want to treat with 1 pad, you're going to put it on the motor point of the muscle you care about, and then a bigger, 4 times greater size pad on something like the low back or thigh. And this will be a different type of dispersion. It'll be dispersion of contraction. You won't get a big contraction over here if you use a big dispersive pad. So pad size can be, for these 2 pads or a little pad and a big pad. So these are your 2 choices. The last message to remember, though, is high volt is really strange. High volt galvanic does seem to have a better contraction potential if you set the active pad to negative. And the man who named this was Dr. Pfluger. Hard to spell, so I'm going to write it big, Pflugger. Pfluger's law says use the cathode. So it's cathode for action, for active pad. Sorry for the mess on the board. I think good boards always go from nothing to big things. Anyway, the cathode is the one that's going to cause the better action potential, therefore the better contraction. So I've played around with this quite a bit. I've decided to figure out if this is really true. So if you want to test this out, take 2 exactly same size pads, set it to HVG, or HV is sometimes the nickname that you'll have. Right here it just says HV, high volt. You can see the double peak right there. Put 2